Hello, my name is Csmith. I'm a student here in the athletic training program at Florida Gulf Coast University, and I'm going to show you how to do a cranial nerve exam. So you do a cranial nerve exam if you have suspected concussion or any other suspected brain injury. So the first nerve we're going to be testing is the olfactory nerve. So I'm going to have them close their eyes. I'm going to grab an alcohol pad out of my bag. I'm going to ask them, can you smell this?
Yes.
What is that?
Like strong as like alcohol.
Yeah, so that would be a pretty good response. The next is the optic nerve, which does vision, and we can do that by simply having them read the scoreboard or read something. So across the room we have a sign, so can you go ahead and read that sign?
The nervous system.
And you got that correct. So in the olfactory, I forgot to mention this, in the olfactory nerve, if they weren't able to smell it, or they said, oh hey, this doesn't smell like an alcohol pad, something else, then we would be suspicious of injury to the area. Optic, if they weren't able to read that or they read it incorrectly, we would be suspicious to an injury to the optic nerve. Ocular motor, so we're going to go ahead and get our pen light. So I'm going to go ahead and cover the eye. I'm going to go ahead and bring the light over the pupil, and I'm looking for dilation and constriction. So if the pupil is constricted, and when I move it away, for it to dilate, and we're looking for it to do that on both eyes. So if they had a pathology to that nerve, perhaps like maybe the pupil wouldn't constrict, or when I moved away it wouldn't dilate. I'm also looking for the pupils to constrict and dilate at the same time. Next we have the trochlear nerve. So we're going to take them through, and that covers the ability to press and adduct the eye. So we're just going to take them through the STAR test, making sure the eyes aren't shaking, that they're able to move the eyes well, they're able to follow with both, and that they're not rotating their head back and forth, any accessory motion besides strictly moving in the eye. So after that, we're looking at the trigeminal nerve. So we're going to have them go ahead and bite down, and then we're going to check for face sensation. So I'm just going to ask them, do you feel this correctly, evenly on both sides? If they couldn't bite down, if they couldn't clench their teeth, if they didn't feel the sensation evenly on both sides or at all, then we would suspect injury to the area. So next is the abducens nerve. Again, we're just going to be redundant on this one. So this is the ability to adduct the eye past the midline. So we're just taking this eye first, follow, and then follow. There we go. You see that the eyes can move well past the midline. If they couldn't, then we would suspect injury to that area. So next is the facial. So go ahead and close your eyes, go ahead and smile, go ahead and frown, make a really big frowny face, and like you're surprised. Yeah, look at there. Okay, so we would say that's pretty good. And we could also have them taste. So if you had something for them to taste, perhaps like a tongue depressor, if I had one, we can see if they can taste like the wood taste of that tongue depressor. Next is the vestibulocochlear. So we're going to have Rob close his eyes. I'm going to ask, what side do you hear this on?
All right.
What side do you hear this on? What side? What side?
All right. How about you?
Okay, so he could hear the sounds, so that would indicate good hearing. We're also going to have him stand up. Kick that stool out of the way. So which foot will you kick a soccer ball with? Left. Okay, so you're going to stand on your right foot, and have you go ahead and close your eyes, just 2 feet for right now. And we're checking for good balance. If he was swaying, losing his balance, then we would be suspective. And then go ahead and stand on that right leg, just balancing that leg. Just hold it. And we're just looking for good balance, see if he's swaying, moving his hips, opening his eyes, placing his foot on the ground. Anything like that, that would be indicative that he had bad balance. I would be suspective of an injury to that nerve. Next we have the glossopharyngeal. So you can go ahead and lift your neck up. Go ahead and swallow for me. And we could see that the hyoid bone was moving up and down, as well as the cartilage of the thyroid. If it was a larger individual, maybe like a lineman, we would be able to palpate that. So if we couldn't see the neck muscles and bones moving up and down, we could feel it. Next we have the vagus nerve. So it's kind of redundant to the glossopharyngeal. So making sure they can swallow, making sure they can speak, and it would also be the gag reflex. not going to go there with this one, but we would take the tongue depressor, Next, and of course with these two, if they couldn't do any of the above, they couldn't swallow, they couldn't speak, obviously we would be suspected of an injury to either of the two nerves. Next is the spinal accessory nerve. So this tests for the trapezius and the sternocleidomastoid. So go ahead and shrug your shoulders. Nicely done. Go ahead and look left. Go ahead and look right. And we're looking for him to be able to get that full range of motion, be able to shrug his shoulders. Other than that, we would be looking, if he didn't have those two, we would be suspected of an injury there. And next is the hypoglossal nerve. So go ahead and stick your tongue out. Go ahead and move it left, move it right, up and down. Beautiful. Okay, so that is a full cranial nerve exam. Any absence of being able to do one of these motions or movements, or being able to do them abnormally or not being able to do them all, would be indicative of a cranial nerve pathology. Thank you.